Hey everybody, it's Dr. Reiser. If you like what you see in our videos, make sure you click subscribe so that you don't miss out on any future videos about functional medicine, nutrition, and tips on how to reclaim your health the easy way with Functional Health Center of the Carolinas.
Hey everybody, it's Dr. Reiser, another Whiteboard Wednesday, and I know, another video about coronavirus, COVID-19. I don't want to talk about it much anymore either, unless I find something that is important to share with my patients and important to share with the public, the people that follow us. And something came through my email that was a research article that just made a lot of sense. And if you know me, I love research. I love to scan through research and make sure anything that we're doing treatment-wise or any advice we're giving is backed by research. And this article came with it, guys. It was amazing. And the things that they were talking about were reasons why certain people are at high risk, and really one specific reason why a lot of people we're finding are at high risk, and why there's a certain amount of people that don't seem to be high risk for coronavirus, and also how it ties into the mortality rate. Why are certain individuals susceptible to mortality from this virus and others seem to just get it and get rid of it? We know that there was research coming out about vitamin D levels and the vitamin D deficiency being linked to higher mortality rate or higher incidence of catching coronavirus. And that makes sense. Vitamin D is very important. It's important with the immune system especially. But this article highlights something else that's involved in detoxification and the immune system. And what they are saying is this might be the very reason that certain individuals are at higher risk. So that's what we're going to get into now. We're going to talk about the molecule or the tripeptide called glutathione. So glutathione is your body's master detoxifier. It gets the crud out of your system. It is the vacuum cleaner for your body, basically. It's mostly active inside the liver, but is active in all other cells, and it gets rid of excess hormones. It makes sure it gets rid of toxins out of your body, cleans your body out, and it regulates the immune system. It helps balance your immune system and is a very antiviral molecule. It helps T regulatory cells, which are a part of your immune system, stay in balance. So this is an important molecule, and what they were doing in the research is trying to assess, okay, let's take some people that we know have coronavirus and see, as compared to people that don't have it, what is the status of glutathione levels in their body? And you can measure these. We measure it frequently with our patients. What is your glutathione status? Because we know a lot of our patients that come in here that are sick typically have low levels. And that's what they were looking at. They wanted to assess what are the risk factors of having low glutathione, and is it plausible that this is a major factor in COVID-19? And in their article, they're saying, yes, it is. And it might be the major factor with COVID-19 and catching this deadly virus. So what they were looking at is individuals that had coronavirus and individuals that were the most sick. As it went along the line from least sick to most sick, and then from people that didn't have it to did have it, low glutathione levels. Every single individual that had it had low glutathione levels. The people that got the most symptoms had the lowest glutathione levels. So there's a major correlation there that we're finding that this must be, something related to having low glutathione status. And if you look at what glutathione does, it makes sense. It cleans out the body, it detoxes the body, and it's an immune supporter, especially against viruses. All right. So in the article, they also addressed the risk factors for having low glutathione, and that's what I'm going to go over now. So the people watching this, you can say to yourself, okay, I might be glutathione deficient. Should I get tested? And what can I do right now to give myself a boost to keep myself from getting coronavirus, possibly getting it? Obviously, it's not the end-all be-all. I'm not saying that this is the treatment for coronavirus, but this might be something you want to look at and assess for yourself. So let's wipe the whiteboard down here and get moving. So if we're going to look at risk factors, number one, we're going to point out the gender that is most likely to have a coronavirus deficiency. And unfortunately, guys, that's you, males. So males typically have lower glutathione levels than females. That does not mean that as a female you're not going to have lower glutathione levels, but if you are a male, that's going to put you at a disadvantage. Number two, if you are a cigarette smoker, they assessed in the study that cigarette smokers seem to have lower glutathione levels. Number three, If you are somebody that has a poor diet, and I know that's pretty generic, but we're going to get into this in a second, how to boost your glutathione levels with food. So what they were basically saying is the people that were eating low glutathione containing foods were essentially had low glutathione or were deficient. Number 4, we're going to look at age range. When you hit age 45 and especially 65 and older, you are going to have issues with glutathione levels. When you hit 45, your glutathione levels start to drop in your body. At 65, you can be deficient. Your absorption, your production goes down. They've found that people that are 45 and 65 and older would be more likely can have a 50% drop in the amount of glutathione they have in their body. And remember, glutathione is in every single cell in your body, the brain, the heart, the kidneys, the liver. It's cleaning those cells. It's a master antioxidant. It cleans out free radicals. So what they're also finding, obviously, cancer issues. People with cancer issues tend to have low glutathione. So this is something your body desperately needs. And if you're in that age range, make sure you get it assessed, okay? So we've got males, we've got cigarette smokers, we've got diet, which we're going to assess here, 45 and 65 years older, and the final one, which makes sense, and as we put these all together as to why this type of person, if you are deficient in glutathione, would catch corona, would be 5, chronic disease. So they found that individuals with chronic diseases, and those would be type 2 diabetes, cardiovascular disease, hyperlipidemia, so cholesterol problems, autoimmune diseases, all of those people, those patients had low glutathione levels. Well, not all, most of them. You can't say, oh, I'm just kind of paraphrasing here for them, but the majority of these people that have chronic diseases typically have low glutathione levels. I know in my practice that the majority of people in here that have chronic diseases, when we assess their glutathione levels, typically low. And again, now that we put all this together, males, we have cigarette smokers, diet that's poor, age, and chronic disease. What does this look like? This looks like the typical high-risk coronavirus patient, does it not? So that's what they were saying in the research, is that maybe this is the correlation. Because of all these risk factors, glutathione goes low. Now you're at higher risk for COVID-19. So what can we do? All right, obviously some of these are self-explanatory. Stop smoking cigarettes. Diet, you can clean that diet up, and we're going to talk about the foods. Age range 45 and 65, you can't change that. Chronic disease, sometimes you can't change that. So let's give our bodies the boost that it needs through diet. Let's name some foods, and you can supplement some glutathione here. So let's get into that. So foods that help your glutathione production are going to be foods that contain the precursors to glutathione. And like we mentioned, it's a tripeptide, and what that basically means is it has 3 amino acids that make it up. You have glycine, cysteine, and glutamate, and all 3 of those combine when you eat foods, and that produces glutathione in your cells and in your body. But you can get glutathione as well from food. So let's talk about some of these foods that you want to make sure that are in your diet, and try to get as much as you can. Some of these may not like, but first is eggs. We have to make sure we're getting eggs. Don't worry about the cholesterol. Obviously, I've done a ton of videos on that. Number 2. We have onions, high glutathione levels. 3, we have avocados. 4, garlic. So those 4 foods, try to get into your diet. They have high levels of glutathione. Input that in your diet. In general, meats, seeds and nuts, and vegetables have high glutathione levels. So as you can see, the poor American diet, the standard, sad, standard American diet, doesn't have a lot of vegetables and meat. We typically eat our, oils and sugar and potatoes and that kind of stuff, which actually potatoes do have a high level of glutathione, but when you're eating French fries, it kind of negates the purpose of eating those potatoes. So these would be the foods that you want to add into your diet. Now you're also asking, well, I heard that glutathione breaks down. I heard that these amino acids break down. That is true. It's hard to take glutathione because it digests very easily. But if you're taking enough of these amino acids from these foods, you will be able to make your own glutathione. So let's get into the supplements. 2 we're going to talk about. So if we have problems and it's very hard to, as far as taking in glutathione because it's hard to it digests very easily, it breaks down very easily, we want to make sure that we can take a supplement that has the precursors. So one supplement that we talk about all the time here and I use quite frequently is glutathione recycler. So it says it right in the name what it does. It's from Apex Energetics. You have to have a physician to get this product. If you're seeing Apex Energetics on Amazon, don't get it because a lot of that stuff is third parties getting a hold of it, reformulating it. You can't really trust what you're finding on Amazon or a lot of these websites. So this is a product that we have. Inside this product, the main ingredient that helps your body produce glutathione is N-acetylcysteine. So this is something that I would definitely use. So we'll put number 1 up there, glutathione recycler. And then number 2, we can follow that up with a supplement that has pure glutathione in it. And this is one that we use very commonly in the practice, and it is called glutathione. So it's from Quicksilver. It's a liposomal form of glutathione. You squirt it in your mouth, and that allows it to get through into the bloodstream, into the tissues immediately. And there's some discrepancies about whether this works or not. There are a few research articles out there that do say that this works very well. And I'm not talking about the product itself. I'm talking about glutathione, ingesting glutathione. If it is basically nano-emulsified, if it's liposomal, it has these phospholipids around the molecule like this one does, it has been shown in research to get into the cells and give you a straight boost of glutathione. So in my opinion, this is one of the best. This is why we use it all the time in patients to get a real short-term boost of your glutathione. Add this to the mix and that will help you cycle through, create your own glutathione, and there you go. You have a major boost of glutathione that might lower your risk for coronavirus there. So Quicksilver would be the other one. And the dosage, if you aren't using either of these two, I know people are going to ask, well, how much do I take if I find something else? I'm advocating for these two. If you're taking something else, I can't help whether or not they're potent or not. But anywhere from 250 milligrams to 1,000 milligrams has been shown to move the needle as far as glutathione and glutathione deficiency in individuals. People can take up to 1,000 milligrams a day and it doesn't seem to cause any problems. But you just want to watch, make sure you're under the supervision of a physician to make sure that there are nothing going wrong when you're taking that high of a dose, especially if you think you're somebody that's at high risk, what we mentioned earlier. But this is how we can try to get our bodies prepped and prepared in case you do have to go out to the grocery or you have to go out to doctor's appointments and things like that. I think it was really important and great for this research article to kind of point out what we already knew as far as risk factors, but now we have a why. Why are the people that have chronic diseases, that are older, that maybe have issues with diet, why are those people the ones that are super susceptible to coronavirus and have a higher mortality rate? This seems to point out that it's glutathione deficiency. Okay, so get it assessed. If you'd like to see what your glutathione status is, you can do a test kit here with us that'll show actually all your other vitamins and minerals. And if you really don't want to go that route and you just want to know if you can boost up your levels and start to eat better and cleaner, follow this advice. You can grab the supplements from us. Obviously, we always put at the bottom of the caption underneath here. DM us, email us if you would like to get a product or some advice or a test kit. Next week, guys, I'm going to talk about B vitamins and how important they are. We're going to do kind of a B vitamin special through all of our Whiteboard Wednesdays in the next few weeks. But thanks for listening to this today. This is some important information. This is stuff that you want to make sure that you really assess and evaluate for yourself. Do you have any of these risk factors? Are you at higher risk? What can you do about it? And the two that we are seeing is the vitamin D, and now finally another big one, glutathione status. Make sure your glutathione status is high and you're not deficient. Thanks, guys, and stay safe.